All right. Hi, everyone. Thank you for being here tonight. My name is Amanda Zubricki. I'm a myofunctional therapist and the founder of the Myo Project. What is tonight about? It's meant to be a simple, family-friendly introduction to myofunctional therapy. We will keep these things on the surface level and practical so you guys can walk away with a better understanding of what myofunctional therapy is, but breathing and sleep matters so much for growth and health. Common sign parents may notice in children and adults, how therapy helps support healthy oral and airway function. If you think to know, this is not about diagnosing anyone tonight. It's definitely not about creating fear. So my goal is to simply provide information, answer questions, and help you better understand the connection between breathing, sleep, oral habits, and overall development. You will hear me talk about things like mouth breathings, tongue posture, swallowing patterns, oral habits, and sleep quality. These are all pieces of the puzzle that can influence how a child grows, how well we sleep, and how our mouth and jaw function. On a final note, I also want to emphasize that myofunctional therapy is often part of a team approach. We commonly work alongside pediatric dentists, ENTs, orthodontists, sleep specialists, speech therapists, and other healthcare providers to support each patient's needs. So, thank you for being here again. I hope tonight gives you helpful tools and answers for your family. Okay. I opened my practice about 3 years ago. I am passionate about helping children and adults improve their breathing, sleep, and oral function, overall wellness through early intervention and education. My background in dental hygiene and massage therapy allows me to look beyond just the teeth and focus how the mouth, the tongue, jaw, and airway all work together. I just want to take a moment to share why this topic is so deeply personal for me. My journey into myofunctional therapy isn't just professional. It's personal. So I've had two babies who were intubated while my second daughter intubation only lasted a few days. My my daughter here, she was much more complex and life-threatening. She was incubated for a month following the surgery. In the beginning, it seemed like it she was progressing so well. And then when they tried to extubate her, she experienced severe side effects and complications. So that eventually led to issues like pulmonary hypertension. At one point, she needed ECMO. She almost needed ECMO. And she was placed on nitric oxide for a couple of weeks to stabilize her blood gas levels. So when she was finally able to 3, I thought that the hardest part was over, but this is when I realized that how much incubation affects the oral and the airway system. Her tongue, her lips, and oral muscles were weak and uncoordinated. She struggled with sucking, her swallowing, and breathing. Things that most babies naturally do without any effort. So at the time, nobody explained the connection between her early medical experiences and the challenges that she was facing. I wasn't a lactation consultant, so I didn't have the knowledge I do now about the incubation or how incubation impact or function or how breastfeeding served as a natural form of myofunctional therapy. So looking back now, I understand why these issues happened, but at the same time, I felt lost and very frustrated. So this is part of why this experience planted a seed in me. It can create a ripple effect. So they influence how feeding, swallowing, facial growth, and even long-term breathing patterns. Okay. Before we dive into modern issues like tongue ties, airway concerns, and myofunctional dysfunction, I want to take a step back and look at what nature originally designed for us. So you can see how Dr. Korosimi was an anthropologist. He studied the rural population around the world, people who were completely removed from modern Western culture. He found that the population had virtually no malocclusion, no clotting, and a much lower incidence of degenerative disease that we now consider almost normal. So their faces and jaw develops exactly the way nature intended, wide arches, straight teeth, and optimal airway functions without braces, without surgery, and without therapy. Myofunctional therapy is a specialized neuromuscular retraining program. It utilizes targeted physical therapy exercises to strengthen the muscles of the lips, tongue, cheek, and jaw, and retrain the resting posture and movement pattern. The primary goal is to treat orofacial myofunctional therapy. I'm sorry, to treat orofacial myofunctional disorders. Abnormal muscle patterns that interfere with basic functions like breathing, chewing, swallowing, and speaking. Therapy supports function, not just teeth. For speech, the therapy can be beneficial with um, individuals who have speech difficulty caused by OMD or facial myofunctional dysfunction. By improving muscle control and coordination, speech clarity, and articulation, they can be enhanced. Nasal breathing. is essential for optimal health. Myofunctional therapy helps individuals who have developed a habit of mouth breathing to transition to nasal breathing, which is the natural and preferred way of breathing. The you are not getting enough oxygen while you're sleeping. The vast majority of natural HGH production, up to 75% of your daily output, occurs in pulses during slow wave sleep. So that means you're in a deep sleep. Disruption to your breathing during sleep can directly impair your human growth hormones. So, if you see here, your tongue should be rustling across the floor of the mouth here, and this is your airway. Your tongue should be sealed in the roof of your mouth to clear the airway here. If it's just low, it's gonna sit back and make the airway smaller. The pressure exerted by the tongue during swallowing, up to 500 grams per swallow, repeated 2,000 times a day, helps expand the upper jaw, creating a broad U-shaped structure that houses all the teeth comfortably. The tongue plays an important role in the development of craniofacial structures. At rest, the gentle and constant pressure of the tongue against the hard palate is counterbalanced by the pressure provided by proper lip sealing and served as a guide for maxillary grip. Myofunctional therapy addresses harmful oral habits such as thumb sucking, pacifier use, prolonged bottle feeding. These habits can impact facial development and oral function, leading to potential dental and speech issues. A habit elimination program focuses on understanding why the habit is occurring, helping children build awareness, providing positive strategies and encouragement to replace the habit. So this isn't about punishment or shame. Instead, we work together as a team, talk, parents, therapists. We want to create new habits to support healthy growth and development. So the goal is not only to stop the habit, but also to support proper tongue posture, nasal breathing, and oral functioning so that the habit is less likely to return. Again, every child is different, but when you address it early, habit elimination can support healthy oral development and may reduce the need for extensive intervention later. All right. So I'm gonna share a video. Myofunctional therapy helps correct these patterns and promotes the proper swallow.
The reverse swallow starts with the lips opened and much activity from the lower lip and mentalis area. The teeth are not together and usually separated by the tongue. The mandible is moved backwards during the reverse swallow. The tongue tip moves down and forward between the teeth. The tongue body moves down and away from the maxilla. Note the backward movement of the mandible. The action of the tongue distorts the upper arch. The tongue moves between the anterior teeth, causing lower crowding and class 2 malocclusion. The TM joint is compressed as the condyle is moved back during each and every swallow.
All right. I thought that was a very good video explaining. Now, this is another normal swallow.
The normal swallow is not spectacular. The lips are together at rest with minimal activity. The mandible moves slightly upwards as the teeth contact. The tongue tip moves up against the premaxilla, followed by the body of the tongue pushing against the maxilla. This creates the correct arch form and good dental alignment. There is minimal compression of the TM joint.
All right. So, when we do myofunctional therapy, it uses a series of exercises to target specific facial and oral muscles. They are helping to strengthen the weak muscles, relax the overactive muscles, and establish proper muscle function and coordination. One provider isn't enough. All facial problems are really isolated. The systems are connected, so multiple specialists often need to be involved for lasting results. One of the most common questions I get is whether myofunctional therapy is only for kids. While early, while early intervention is wonderful, we can support growth and development. As it happens, adults can benefit too. The goals may look a little different, but both children and adults can improve the breathing patterns, oral function, and quality of life through consistent therapy and habit changes. So it's one of the common questions that I get is what happens during an evaluation. So it's a comprehensive assessment that helps us to understand how the muscles of the mouth, your face are functioning, whether there may be fatigue affecting breathing, sleep, and oral development, or overall functions. Another question is how long does myofunctional therapy take? The answer really depends on the age, the goals, and the specific needs. It's not a quick fix. It's a process of learning new muscle patterns and building habit. That just becomes automatic over time. Myofunctional therapy has been shown promise in improving various facial issues and promoting overall health. Individual outcomes do vary. I love this quote from Dr. Silkman because it highlights something that people have never considered, that your tongue plays a powerful role in oral development and function. When we think about orthodontics, we often think about braces, expanders, or retainers, but your tongue is a natural force that is present 24 hours a day, every day. Its posture can and function can influence the development of the jaw, the shape of the palate, and the position of the teeth. Even how we breathe and swallow. All right. So thank you for being here tonight. I hope you learned more about breathing, sleep, oral habits, and tongue function can impact overall health and development. My goal was to simply provide the information and help you understand some of the signs and symptoms that may be worth paying attention to in yourself or your child. If you have questions after tonight or would like to learn more about myofunctional therapy, I would be happy to connect with you. You may email me hello@themyoproject.com. So thank you again for your time.